Okay, so as you guys asked, I will go through some of the questions, all the questions on the workbook. I should be able to just post the responses I think everybody submitted, so I can post those up too. But I figure I'll talk through some of these answers, questions, and hopefully you guys, your responses look pretty good from the workbooks that I've seen. But yeah, maybe just a little bit better understanding. So we'll go through. So first one, diagram the stick figure, anatomical positions. So, oops, pulled on the cord. Okay, so body orientation. Off my cord. Okay, body orientation. We are standing upright, position of palms facing forward, supinated because I can hold some soup, right? Position of the feet together, slightly apart, forward, and head position facing forward. So, critical thinking question, the anatomical position is the starting position for movements. When measuring range of motion, what degree position does anatomical position represent? That is 0 degrees. It is the 0 position or the starting point. Joint measurements begin with this position. For example, shoulder flexion starts at 0 and moves to 180. All right. So the different things that might be wrong, obviously, palms facing backwards. They should be forward, supine, holding the soup. 1 foot turned out, make them both forward. Head turned to the side, face it forward. And arms at a 45 degree. They should be at 0, down at the sides. Okay, moving on to directional term mastery. The head is superior to the pelvis. It means above towards the head, so it's superior. What's the next one? The biceps brachii muscle is deep to the skin and superficial to the bone. So deep towards the interior relative to the skin, and superficial towards the surface relative to the bone. So the bone is deeper. It should go skin, muscle, bone. All right. The right hand is contralateral to the left hand and ipsilateral to the right foot. Okay, so contralateral, opposite sides, contradict. Ipsilateral is the same side of the body. Right hand, right foot, same side. Okay. Lateral could also be acceptable for the first blank, just so you know, but contralateral is more specific. So let's see, partner practice. Proximal to your wrist, on your forearm, between your elbow and your wrist. Awesome. Lateral to your sternum. So this is going to be towards the outside, away from the midline. Distal to your hip. So that would be on the thigh area. And contralateral to your right shoulder, left shoulder. There we go. All right, so let's match up the planes. Sagittal plane passes vertically. It divides the body into the right and the left. Remember, think about things that sag, separates it. Frontal plane, coronal plane, drink corona in your mouth, splits it front and back. And the transverse plane, it passes horizontally through the body, top and bottom. All right, the frontal axis passes side to side through the sagittal plane. Okay, frontal axis passes side to side through the sagittal plane. The vertical axis passes through the superior to inferior horizontal plane. So the vertical longitudinal axis runs from top to bottom, head to feet, passing through the transverse horizontal plane, allows for the rotations. Okay, so the plane, sagittal. The axis direction is frontal, side to side, and the movement will be flexion, extension. sagittal plane, frontal axis, extension, flexion. So frontal plane, sagittal is the axis, and this is abduction, adduction. Take it away from the body, add to the body. Okay? Jumping jacks, things like that. Transverse plane goes across here. Vertical axes, top to bottom. And any sort of rotation, trunk twist, shoulder rotations, those kind of things are going to be the demonstrated exercise. All right, let's move on. So, which motions occur in the frontal plane? This is abduction, adduction. Frontal plane movements, side-to-side movements, away from or towards the midline. Which motions occur in the sagittal plane? This will be flexion and extension. All right, so then you have some hands-on work. Sagittal plane station. What do all of these movements have in common? They all involve forward and back motion, flexion and extension. Walking involves the hips and the knees, flexion, extension. Bicep curls involve the elbow, flexion and extension. Squat involves the hip, knee, ankle flexion and extension. They're all bending motions in the sagittal plane. Frontal plane. In what plane do scapular elevation and depression occur? Frontal plane. Scapular elevation, shrugging shoulders up, and depression, pulling shoulders down, are vertical motions. Scapular moves up and down, and this is a frontal plane motion. Transverse plane. Wood plane, axes, horizontal, vertical. Rotational motions are going to occur in the transverse plane around the vertical longitudinal axis. So the dowel rod is going to pass vertically through the body, head to toe, or through the long axis rotating limb. Yeah, if we're doing a limb thing, but the basis of it, the default, would be through the head, out through the feet. All right, so next, within which plane and about which axis does the trunk lateral flexion occur? This will be frontal, sagittal. So the plane is going to be frontal, the coronal. The trunk bends side to side, right to left, dividing front and back. The axis is going to be sagittal. This is going to run front to back through the vertebrae. The axes will pass through my body horizontally from front to back through the spine at whatever level I'm bending. For a trunk lateral flexion, it typically passes through the lumbar or thoracic vertebrae. Okay. Why frontal plane but sagittal axis? The perpendicular rule says that it has to be a 90-degree plane. So the frontal plane is going to divide the body into front and back. To bend side to side in the frontal plane, the axis must be perpendicular to that plane. Therefore, the axis runs front to back through the sagittal plane. Like a door hinge. So, boop, boop. You got it. All right. Let's move on to joint classifications. How many degrees of freedom does a biaxial joint have? 2. Biaxial. How many planes does a triaxial have? 3. Triaxial. Good. All right. So uniaxial, 1 degree of freedom, 1 plane of motion, number of planes. Body examples: elbow, knee, ankle. These guys. Biaxial, 2. Number of planes, 2. This is going to be the wrist. Ankle, some consider it. Triaxial, ball and socket, 3 degrees of freedom, 3 number of planes, and we only have 2 in the body, the shoulder and the hip. So how many directions in a uniaxial? Good, we got those. All right, moving on. Okay, let's go part B. Osteokinematic motion. Osteokinematic motions include flexion. So flexion is osteokinematic motion. You could observe the bone movement. Okay, you could observe it moving. This one. Roll, spin, and glide. Those are going to be arthrokinematic that aren't visible. So also the slide that we talked about today and the knee joint. What makes flexion and osteokinematic? Well, roll, spin, glide are not. They're visible, gross movements of the bones that we can see and measure, like flexion, extension. Arthrokinematics are microscopic movements occurring between joint surfaces. So flexion we can, observe, and we can actually measure with a specific meter for it. And the roll, glide, spin are what happens at the joint to allow that flexion to occur. So osteokinematic motion of extension is defined as movement of limb segment surfaces, anterior away from each other. So during extension, the anterior front surface of the limb segments move away from each other. Let me slide over. So we have extension. The anterior part slides away from each other. During flexion, they come towards each other, away from each other. Osteokinematic motion of abduction is defined as movement of a limb away from the midline. Add it to the midline. Adduction. Remove it, absolve it. I don't know. I just remember add it to the midline rather than trying to remember something with AB. Add is better. Yeah. I mean, come up with your own things. Just telling you what I do. All right. So, movement exceptions and applications. Which of the following motions does not conform to the definition of motion? Knee extension. So, do the anterior surfaces of your leg segment move away from each other? No. During leg extension in a seated position, the anterior surface remains relatively stationary. The anterior surface of the lower leg moves backward posteriorly. This is during leg extension. Posterior surface actually moves away from each other. So, let's see what the questions are. Okay, there we go. Got that. Now on to the kinetic chain concepts. An individual sitting on a high stool swinging their foot or their feet is an example of open kinetic chain. It's not attached to anything, okay? It's just moving freely. The distal segment, the one most farther from the trunk, is free to move in space. The foot is not fixed on any surface. So, foot swinging, free to move, open kinetic chain. When we perform a squat, your foot is fixed. It's on the surface. So a way that I was taught to think about it is whatever area is at the most distal point. Let's use this guy. Imagine it's holding a toy. Do you guys know who this is? I'll give you bonus points if you tell me in class on Thursday who this character is. Anybody? All right. A little something on his face. Anyway, so imagine that you are holding a toy. So the toy, if the toy is being moved, then it's open chained. So if I'm doing a bicep curl, open, okay? If I'm doing a push-up, at this point, think of it like this little guy is moving me. He's super strong, okay? So as I'm doing a push-up, he's the one moving me. It's closed chain, okay? So I like to think of them like holding me at the hand. Am I moving him, or is he using his superpowers and moving me? Because this next section is where I saw some of the issues come up and some confusion pop up. So leg press machine, open or closed? This is where some people got a little tricked up. It's actually open because your feet are still moving. While they are touching a surface, the surface is moving, okay? So don't get caught too much on, is it on something, okay? Think about, is it moving something or is something moving it? Okay, So a leg press machine is open. Your feet are going to push against the platform, but they can move. The platform moves. Seated leg extension. This one seemed a little bit clearer for you guys. Open, right? The feet move free in space. They're not fixed. Seated leg extension. We did that one. Walking. So this one, tricky one. The foot fixed on the ground during the stance phase is closed, but during the swing phase is open. So some exercises are going to have elements of both, like walking. But typically what they'll be classified on is their primary characteristics. So for walking, the primary characteristic is going to be the closed kinetic chain, so the foot on the ground component of it. Swimming, freestyle swimming, that one is going to be an open chain. The hands and the feet move freely through the water. They're not fixed. A bicep curl, open. The hand is free to move, holding a weight, but it's not fixed to the surface. Same thing if you're using one of the machines, right? It is still moving free. So don't get caught up too much on what machine or what apparatus we're using. As long as that most distal part is able to move within space, then it's open. And a push-up. Flat on the ground, this is closed. That little doll is moving me. Boop, boop, boop. Okay? I am not moving the doll or the action figure. Whatever you want to call it. All right. So, critical thinking. Why does it matter if an exercise is open or a closed kinetic chain? So closed kinetic chain exercises are going to have more functional. They're going to actually mimic everyday activities. Closed kinetic chains are going to mimic more everyday activities. Multiple joints are going to work together, which means that you're going to have greater stability required. So thing that a lot of people don't know is that squats, especially front or back weighted squats, are going to be one of the best core exercises that you can do because they need to be engaged for stabilization. It's often safer for joint rehabilitation because they're fixed, right? Things cannot get super haywire. It's controlled. Squats for knee rehab versus leg extensions are going to be safer. Open kinetic chains, these can isolate specific muscles a little bit better. They're easier to control the resistance, good for early rehab because there's less load, and can target weaknesses specifically. And a leg extension will isolate the quadriceps versus a squat, which is going to engage so many other, the core, the quads, the hamstrings, the glutes, even the calves for stabilization. And then we have the tendons and the ligaments that are going to be strengthened due to that stabilization. So exercise program design is often going to start with an open kinetic chain, less demanding, isolating weakness, and then late rehab is going to progress to more functional sports-specific closed kinetic chain. So again, closed kinetic chain is safer for joint rehab. Okay. So, let's see. We will go through the movement analysis. I chose reaching into an overhead cabinet. So starting position relatively to anatomical position. So if I stand in anatomical position, then move into a shoulder flexion and possibly a slight trunk extension. Okay, reaching for something in the cabinet. Oof, right? I'm shorter, so I'm gonna have to do more of a reach. Not counting if I jump on the counter or a chair and then there's more steps, but let's just go with I'm tall enough to reach the cabinet. There it is. Okay, so the primary joints involved. We are going to have the shoulder joint, the glenohumeral, the elbow joint, and possibly the spine, depending on how high I'm reaching. Directional terms. My hand is going to move superiorly, superior, you know what I'm saying. Superiorly, it's not working. Towards the cabinet, it's superior. My arm is going to move anterior and superior. Movement is ipsilateral, just one arm only. Planes of motion is going to be sagittal plane with the shoulder flexion and the elbow extension, and possibly the frontal plane if I'm reaching to the side. So what type of kinetic chain is this? Open. My hand is free, moving throughout space. and degrees of freedom at the primary joint. So the primary joint is going to be the shoulder, triaxial. So that means 3 degrees of freedom, mostly in the sagittal plane, and the elbow is uniaxial, just one plane, 1 degree of freedom. Moving on to lab session 2. All right, so you guys work through different muscles. Okay, so a squat analysis. Bicep curl, where is it? Oh, there it is, okay. So during a squat analysis, the descent, the eccentric motion, is going to have the quads, the gluteus maximus is going to be the agonist muscles, and the antagonist are going to be the hamstrings. They're going to be relatively relaxed. Joint action is going to be hip flexion, knee flexion, and ankle dorsiflexion. In the ascent, we're going to have the quads, the gluteus maximus, and the hamstrings that are going to shorten. Hip flexors are going to be relaxing. And again, hip extension, knee extension, ankle plantar flexion. So little note is during the descent, the quadriceps and the glutes are going to work eccentrically to control the lowering motion against gravity. But during the ascent, they're going to work concentrically to produce that upward motion. So the first one, they're controlling and fighting the power of gravity. And the other one is going to be a propulsion that they bring into it. All right, so we skip the levers. We skip the vectors. All right, video analysis. So let's say we do a push-up. So the joint will be the shoulder, one of them. It's going to work in the sagittal and the transverse plane. We're going to do flexion extension, horizontal abduction and adduction. And it's going to be pec major, anterior deltoid, and the triceps are going to be involved. The elbow is going to work in the sagittal plane for flexion extension, and it's going to be using the triceps brachii as the agonist muscle. And the scapula, frontal and sagittal plane, protraction, retraction, serratus anterior, and pectoralis minor, so the smaller pec muscles. This is a closed chain because my hands are fixed on the ground. The toy is moving me. Degrees of freedom required, shoulder, 3, and 1 in the elbow. And the primary lever system used, we'll get to this later, but just so you know, 3rd class lever. All limbs moving at once. So some potential form errors would be excessive winging. So the scapula is shooting out during the lowering phase. So coming back like that rather than holding steady. This will usually indicate weaker serratus anterior muscles, which was the, we talked about it today, they're the ones that stabilize the shoulder within the ball and socket joint. So this is going to lose the closed kinetic chain stability. So because we're on a flat surface and it's not moving, we need stabilization. That's where that serratus anterior is going to come into play, lock it into place. So if you find that someone you're working with or yourself is particularly winging where your shoulder blades are shooting out looking like wings, that is an indication of a serratus anterior deficiency. And this could then increase the stress that's put onto your shoulder, can lead to an impingement. So what you really want to do is strengthen that muscle so that way you are pushing the gown away to engage. Rather than just not, letting yourself chest bump the ground, you're actually pushing it away. That's going to focus on those muscles. All right, let's talk about a little case study analysis. So, a client with knee pain during squats. So the joints involved, the hip, knee, ankle, all the lower extremities. Planes of motion are going to be primarily sagittal, flexion extension in all 3 joints. Osteokinematic motion, so the motions that we can see. Hip flexion during the descent, extension during the ascent, knee flexion, descent, extension, ascent, ankle dorsiflexion during the descent, and plantar flexion during the ascent. So some issues that might happen. Knees that go in, which is valgus, and I talked about the Q angles on females, and this is a very big thing that happens. That will then have hip adduction, internal rotation, and this can indicate either a weak gluteus. A simple fix with that is I will always stress for my female athletes in a squat, I rarely do a back squat, I'll do a front squat with them more, and that their knees are pointing out, which typically means turning your toes out more. So that will sometimes correct the problem. Excessive forward knee translation, that means that it is a super quad dominant pattern, and the weaks in the hamstrings are going to be a little bit weaker. So you want to focus on the hamstrings and the glutes to strengthen those if the knees are coming forward too much. Heels lifting, this means that there's limited ankle dorsiflexion, or you might have tight calves. So you really want to strengthen or loosen them up and make sure you do a lot of mobility things prior to doing a squat. Forward trunk lean, weak core, try to shift to center of mass. The most basic thing that I was always taught when teaching a squat, look at the ceiling, okay? Because when you are in this forward hunch position as you're trying to do a squat, it's really hard to see the ceiling. So you need to make sure that that chin is up and you're looking up and you can see the ceiling. And a lot of times that will help position the athlete or the person working out even better. Asymmetrical loading, doing one leg more than the other, right? So as you're coming down, you're putting more weight on your left, your right. This is why the buddy system is good. Someone to sit there and tell you that you're going wonky. So that's a big one. So modifications that can happen: reduce the depth initially, decrease the flexion angle. This will have less of a torque demand, as we talked about today, the different angles, and it'll allow for the proper form without less stress. So you can also widen your stance. This is going to reduce that valgus stress, the knees bent in on the knees, and it's easier to sit back from a hip dominant position. Focus on the hip hinge. Shift from knee dominant to hip dominant pattern. It reduces the anterior knee translation, so those knees come in front of your toes, and engages the glutes more effectively. And you can add a resistance band around the knees. This is going to really activate the gluteus medius. Any of those Frankenstein walks or the clamshells, things like that, those are really going to target the smaller muscle of the tush. So more on the top upper part of the tush is going to be focused with those band exercises. And they do a lot for stabilization. If someone runs a lot, those tend to get weak and a little sad. So you want to make sure that you counter that with a lot of those band exercises. And then you want to strengthen your whole posterior chain, the glute bridges, deadlifts. So this will correct any sort of muscle imbalance where we talked about the quads being overly dominant and the gluteus and the hamstrings being weak. And then improve the ankle mobility. Like I said, there should be a good ankle warm-up before you do a squat exercise. You can always cheat and put an incline plate under your heels to make sure that you're keeping that good angle. And then the movement creation challenge. So this is going to be different for everyone. Mine was a rotational lunge with an overhead reach. So a lunge with a reach and a little spin. So start in a standing position, feet together, step forward into a lunge, sagittal plane. Simultaneously rotate the trunk toward the front leg, transverse plane. Reach both hands overhead and slightly lateral. So this is the frontal and the sagittal plane. We got abduction, adduction, right? And then return to the starting position with control, and then repeat on the opposite side. So the lunge step is going to be in the sagittal plane. We're going to have hip flexion, front leg, hip extension on the back leg, and knee flexion for both. The primary muscles will be the hip flexors, quads, and glutes. Trunk rotation, transverse plane, going to have spinal rotation, internal and external obliques. This is going to be that force coupling that we talked about in class, where the multiple muscles working in different directions are going to create that process of coupling and rotation. And the overhead free reach is sagittal and frontal. shoulder flexion, abduction, deltoids, and rotator cuff. So agonist, antagonist is going to be the hip flexors versus the hip extenders, the right internal oblique versus the left external oblique, and the deltoids versus the lats. This is effective because it is multiplanar. It allows for core stability because transverse rotation, while maintaining that frontal and sagittal plane, is going to integrate core, supercore. There's going to be a closed kinetic chain for the lower body. Dynamic balance, a single leg loading with multi-directional movement is going to challenge both balance and proprioception. Compound movements, multiple joints, muscle groups working together. So athletic carryover is going to mirror any sort of throwing, cutting, change of direction motions in sports. And it's scalable, so you could change the lunge depth, you could change the rotation amount, or you can add some external resistance, maybe a medicine ball, something like that. So that covers week 1 workbook. So go through, again, let me know if there's anything that you're a little bit stuck on, and I am more than happy to help. All right, I'll try and post the completed workbook too, just to give you something to go through. All right, take care.